issues with levodopa. So people can develop what we call motor complications, which consist of motor fluctuations and dyskinesia after being on levodopa, typically for longer periods of time. So motor fluctuations are when the levodopa is not lasting from dose to dose. So for most patients, when they start on levodopa, they typically take one pill 3 times a day. And they do well with that, and it lasts all day, probably for the first few years. And then as the disease progresses, that levodopa lasts shorter and shorter. So it may last 5 to 6 hours when you first start the medication so that you feel the same all day. And then one thing we'll always ask you at the visits is your levodopa lasting from dose to dose? Because it may be then it goes down to only 4 or 5 hours, and you start to notice that when the medication wears off, the Parkinson's symptoms come back. Slowness, stiffness, for some people tremor, and more difficulty with movement. Then they take their next dose, take a half an hour, 40 minutes for that to kick in, and then they do better. But this up and down throughout the day is what we call motor fluctuations. And it's a very common complication of advanced Parkinson's disease. The dyskinesia is the involuntary twisty-turny movement, like you see when you see Michael J. Fox on TV, so he's probably the best example of dyskinesia that most people are aware of. So if you've seen him on the shows, he has a lot of involuntary movement, and that's a result of the levodopa. The disease too, but the levodopa, because it's up and down like this and in the brain, and the brain doesn't like that.
Without levodopa, there's never an instance of the dyskinesia?
I think it could potentially happen with some of the other dopaminergic medication, but much, much, much less likely.
So that specific issue is a result of medication?
Yeah.
So if you took a person that never had it that had Parkinson's, they would never have dyskinesia?
If someone who didn't have Parkinson's took levodopa, they shouldn't get dyskinesia. Is that the question?
No, if you have a person who has Parkinson's but's never been medicated, they will never get dyskinesia?
Right.
Okay.
Right, yeah, result of the medication, yeah. And almost always levodopa.
So why do we put them on?
Because it's the best medication to treat their mobility, their movement. It's the one that helps the most with slowness and stiffness. So for many patients, let's say they've been on levodopa for a few years and they're doing well, and then they develop some of this involuntary movement. If it's bothersome to them, we tell them there are different options we can do, but if we cut back on the medication, it should go away.
Okay, if slowness and movements is a lot less of a problem than dyskinesia.
So for most patients, they would prefer to be dyskinetic and have involuntary movement than to be slow and stiff, immobile, and have trouble moving, yeah. I would say 90% that experience some dyskinesia would prefer to have dyskinesia than to have trouble moving. Any patients agree with that? I mean,
Really? I have a girlfriend who's in a wheelchair because of this dyskinesia. This isn't Parkinson's. She had chemotherapy. She has paraneoplasty syndrome. I would almost guarantee she would do anything to not have that.
well, she doesn't have Parkinson's disease.
No, but if
Yeah.
the movement and the slowness of movement and stiffness would be a much preferable thing to the dyskinesia.
Maybe for her. And I think it also depends on the severity. So I would say we're pretty good at keeping doses lower nowadays than they used to be in the past. So I would say I've maybe seen less than 10 patients in the last 4 years that had dyskinesia that was extremely severe to the point that it affected their ability to walk. So for most patients, they would prefer to have the dyskinesia. Yeah.
Are tremors in the dyskinesia package, or is that a separate thing? Does the levodopa treat the tremors?
Yeah, so separate things. So the tremors, which is also involuntary, but it typically takes the same pattern back and forth. Usually it's upper extremity, can be in the lower extremities too, but that's a symptom of the disease. So that's the Parkinson's disease, the tremor. So slowness, stiffness, and tremor are the 3 motor symptoms we look for in Parkinson's. The question of whether or not it responds to levodopa. Sometimes yes, sometimes no, depends on the patient. So tremor is very tricky for all patients because it may or may not respond to any of the Parkinson's disease medication. It's the hardest symptom to treat. Any other questions? Okay. So the motor complications. So that's the issue, is levodopa does such a good job for treating slowness and stiffness, but then it can cause these issues. Ups and downs, motor fluctuations, where people are having slower times during the day when their medication wears off, and then the dyskinesia, the involuntary twisty turny movement. So the question is, one of the main things is in research right now is focused on finding better levodopas that last longer, so that there's not ups and downs so much, and finding better ways to treat dyskinesia. The only medication we have right now that improves dyskinesia is called amantadine, and this is a medication that can help both slowness and stiffness, and it can also help reduce dyskinesia. But amantadine has, of course, like all drugs, potential side effects, and it so happens to be pretty good at causing hallucinations. So for some patients, they can't tolerate it because of the hallucinations. Patients that are having more trouble with memory and thinking are more likely to get hallucinations from amantadine. So we're especially cautious if we try it in those patients. But basically, you need better treatments to make the levodopa last longer and treat the dyskinesia, and something to slow down the disease.
I may be jumping the gun, but,
Yeah.
when I was at that, seminar, they talked about the pump, and
Yeah.
that's how we remember the pump. And also the inhaler.
Yeah.
Are those things that you're also?
I'm gonna talk about
Okay.
them. Yeah, we'll get there.
I saw that.